Hi, I'm Dr. Sunar and about to do some surgery here. Let me present you what I'm going to do now. This patient presented to my office with two rotting teeth on her upper left jaw, and she's been living with that for a long time, and she's finally decided to rehabilitate that area. So let me show you what I'm going to do here. As you can see in this picture, there are two rotting teeth, number 12 and 13, and her posterior teeth on this in this side of the jaw is they're no longer there. They've been extracted a long time ago. So my goal is to remove these number 12 and number 13 and place an implant in the position number 12 and place an implant in the position number 14 and give her a 3-unit implant to implant bridge in this side, and this will completely rehabilitate on the upper jaw, upper left. As you can see in the lower, she's got full arch of teeth, so she will be completely rehabilitated on this side of the mouth. My goal is also to place another implant on the position number 31. As you can see, she has number 2 tooth but doesn't have number 31. It's kind of a little bit far back, you can't see. Let me see if there's, okay, yeah, you can appreciate on this one. As you can see, there's no number 31 and number 2 is there. Number 2 tooth is not occluding with any teeth, so my goal is to place an implant right here on number 31 position and give another tooth here so that she will have a complete occlusal bite on this side also. So let me present you. I'm gonna also do the simulated surgery on the computer, on the CT scan, so that I don't make any mistake during the surgery. So first thing first, as you can see, I've already I'm gonna map. The first thing I'm gonna do is find out where the nerves are on the lower right side. So I'm going to trace the inferior alveolar nerve, because one thing you don't want to do during the surgery is to nick or touch the inferior alveolar nerve, and that will give her a permanent paresthesia on this side. So it's very important to trace that nerve and stay away from that nerve. Okay, so I'm going to trace this nerve now. As you can see right here, this is let me see. So here's the nerve right here, and we'll trace it, and look at this right here. So here's the nerve, and I'm gonna move this to this. I'm gonna measure the height. As you can see, there's a the nerve is located here, so I have about let's see, close to 10 millimeter of bone structure, and I'm gonna place a little bit of bone on this side also, so I can place an 8.5 millimeter of implant and she'll be fine. So I'm gonna go ahead and do that now. As you can see, I'm staying away from the nerve. So I've got about 3 millimeters away from the nerve. So this is good, and I might have to put a little bit of bone graft here to cover this side of the implant, so they're completely buried in the bone. Now I'm going to place the implant on number 12 and 14 position. So this is the rotting tooth, and I'm going to measure what's the measurement of this bone. So here, I've got about 12 millimeters of bone structure here, and it's a pretty good size. So I'm going to place an implant on this tooth structure. I'm going to do 4.5 diameter of implant, because this is a bridge I want to give. I don't want to give her a small diameter. I want to give her a large diameter so they're strong. So I'm going to place 4.6 and 10 millimeter of implant here. Here, look at this. And I can change the angle right here. So here, this is a 4.6 by 10 millimeter implant. It fits perfectly well in this. It's got a significant portion of the implant is buried in the bone and rest is in the socket, which I'm gonna graft it also. Now I'm gonna place the implant in position number 14. And let me check what's the measurement here. I've got about 7 or close to 8 millimeter bone here. So in this case, I'm gonna have to lift the membrane vertically. So I've got a special tool that I'm gonna use to lift it, lift the membrane without damaging the membrane, and pack bone there, and then I can place a 10 millimeter implant here. So let me go ahead and place a 10 millimeter implant. Now it's a posterior teeth, so I'm gonna put a minimum 5 millimeter diameter. So 10 is a 5 by 10 implant. I'm gonna go ahead and place it now. So I'm gonna play it right here. As you can see, about close to 4 millimeter or maybe 3 millimeters of the implant body is inside the sinus, but that's in the computer. But I'll be lifting the membrane and placing in a bone graft, so the entire body will be inside the bone. So this is how it's going to look. I'm going to expand it now. So here's the implant for the bridge, and here's the implant, the single implant in the posterior side or lower right quadrant. So this is the complete surgery that I just performed on the computer. Now I'm going to replicate same surgery in actual patient. Let's go and do it. The part will be coming out very soon, so stay tuned. And don't forget to like and share this video and subscribe the channel so that you can see the upcoming content.